Good afternoon, fellow Kenyans. Defeating coronavirus will require agile execution, testing, and prompt management of confirmed cases. Indeed, the world over, countries have adopted the mantra, test, isolate, treat, trace. Kenya has adopted this mantra, and today we want to share with you the progress made in execution of this approach. With regard to testing, the Pharmacy and Poisons Board is now accelerating regulatory decisions regarding approval of COVID test kits. The board is implementing stringent, expedited accreditation mechanism, which has shrunk the process from 3 months to 48 hours. Using this approach, the board has authorized the employment of 4 test kits for detecting the virus, which are currently being used. And these include Cobas SARS-CoV-2 test kit by Roche Diagnostics, Expert Express SARS-CoV-2 by Cepheid, BioFire COVID-19 test by BioFire Defense LLC, Abbott by Abbott Molecular Inc. With this approach, our capacity for testing will be expanded from our current 10 to cover at least 1 laboratory in each county. This is expected to take place in the next 2 weeks. We request that incoming applications are uploaded along with the requisite documents to the PPB portal. As shared in the past briefings, the current phase involves deployment of targeted testing with a focus on frontline healthcare workers, identified hotspots and clusters in Nairobi, Mombasa, enhancing community-based surveillance and screening trunk transit drivers. With regard to isolation and quarantine, we have 33 quarantine centers that are currently active. We have closed down a good number of sites. At the moment, we have 483 individuals in the various centers across the country. We have also quarantined 455 other persons for defying national curfew regulations. And I think this is important to note, because once you are out during curfew hours, it is assumed that you have now been exposed, and therefore, if you are taken, you'll be taken to a quarantine site for 14 days at your own cost. With regards to treating, our success on treatment is highly dependent on our ability to protect our frontline healthcare workers and heroes in this fight. To this end, we have distributed 4,759 complete personal protection equipment kits and 237 assorted components, i.e. goggles, surgical masks, N95 masks, gowns, rubber boots, shoe covers, etc. All quarantine sites and port health facilities have also received assorted protective gear. We have also trained over 30,000 healthcare workers, and training is still ongoing. The target is to resensitize 100,000 more in the next few weeks. 1,000 police officers have also been trained, particularly those manning roadblocks. 1,000 National Youth Service, NYS officers, 300 prison officers, because you appreciate that prison is a very sensitive area in this disease, and 53,000 community health workers using an online-based module by Red Cross, IMREF, and the Ministry of Health. Further to this, we are today launching a special designated isolation and treatment facility for our healthcare workers. This facility will be able to offer both critical care, basic care services for our healthcare workers. All costs incurred during treatment shall be met by the government. This center is a product of collaboration between the Ministry of Health, the Rockefeller Foundation, and AMREF. We thank both of them for this kind gesture. And I think that AMREF is well represented here, as well as the managing director of Rockefeller, who is also here with us. Thank you so much. We really, really appreciate what you have done for us. And we hope that you don't mind if we become those people who are always coming around for seconds. Still on treatment, adequate supply of oxygen is crucial in the management of COVID-19 disease. Towards this, I am appealing to national and county health facilities to settle any debts owed to oxygen suppliers. Those holding oxygen cylinders should also make plans to return them to their suppliers so that we can have them filled up. I am aware that we have a number of oxygen plants of our own in the facilities. However, let me also caution that facilities with such plants should make haste and repair what is not functional, because I'm aware that there are some oxygen facilities that are not functional, but also do a quick cost-benefit analysis to ensure that when you are planning to build a plant, an oxygen plant, ensure that you are getting value for money. Because I am aware that there are some plants that were built by some Czech companies, Slovak companies, that no longer can be serviced because there are no spare parts for some of them. So I would like to urge that before counties and other hospitals think about putting an oxygen plant facility, let's think hard. Perhaps getting it from local suppliers might actually be cheaper and getting them service. In any case, hospitals are not experts at running these oxygen plants. And I think that if you do get a hospital plant, then you might require to do a management arrangement with a company that can settle them. Otherwise, you'll have them all over the country, but half of them will not be working. With regards to tracing, 11 more persons have tested positive for the disease today, bringing the total to 281 in the country. Of these confirmed cases, 7 are Kenyans from Mombasa. And in that Mombasa area, we have got quite a few, I think 3 are from Bondeni in the old town in Mombasa. We have a few also from other areas, Miritini. I think we have a case from Miritini, and a couple of other areas within Mombasa town itself. The other 4 are from Nairobi, and those ones are from Ruaka. The Ruaka area is where we got those 4. And none of those have a recent travel history as such. And 5 are female, while 6 are male. 7 of those are from our quarantine centers, the ones in Mombasa in our quarantine centers, and 4 were picked by a surveillance team from various parts of the country. They are aged between 11 and 80 years old. And I can confirm that the herbalist who died in Mombasa, Old Town, the three in that area, in the Old Town, are actually contacts of the herbalist who died in the same area. And there goes the whole idea, and why we are always talking about keeping distance. That's why we are always talking about people going around and not taking care and not wearing masks. These are some of the results that we are getting as a result of these shortfalls. We are also happy that 2 patients have recovered and been discharged. And out of those 2 patients, I can also report that one of them is a doctor. We are 2 doctors who had tested positive, and one doctor is still under treatment, while the other one has recovered. So we now have a total of 69 recoveries. The number of people we have lost remains at 14. Today, I also want to make a special appeal to people in the counties of Machakos, Kajiado, Kiambu, and Murang'a. As Nairobi metropolitan counties, you have a special responsibility to guard against the spread of coronavirus from Nairobi County. Already, a number of your residents have contacted the virus, and we have isolated them for treatment. In Machakos, for instance, we have 7 cases. 1 from Syokimau, 1 from the 2 from Syokimau, and there is 1 each in Athi River, Kamulu. We have a case now from Kamulu, Ruby Garden Estate. We have a case from Kithunguni and Viranji. In Kiambu, we have a case each of the following estates. Githurai has a case, Githurai 45, Dongoru, Ledegua, Tinganga, Waithaka, and Wataalam. Kajiado 2, we have cases in Kitengela, in Matasia, and Ongata Rongai. In Murang'a, we have 2 cases in Gatanga and Lumumba Drive. All these cases are being treated in our various hospitals, and we hope and pray that they will soon be cured. But the reason for mentioning the specific areas is to establish and to show you that it is not a Nairobi disease, it is not a stranger's disease, it is something in your neighborhood. It is something that is being carried by a brother, a sister. It is something that is within a friend that you have, and therefore it is just to emphasize the need for social distancing and the need to be just careful as we move along. I think if we do that, if we are careful, then we can continue to contain this disease. You will notice that it is growing. As you can realize, Mombasa, 7 in a town in one day in Mombasa, that is not a small number by any standards. And if you can multiply a factor of 4, it tells that if you do not withdraw those people from the town, then each of them will go and multiply by 4, and there goes the exponential figures that we have been talking about. So today, ladies and gentlemen, members of the press, the reason why we are here is essentially to take care of our frontline people, to ensure and to encourage them, and to tell them we are thinking about them. As you are aware, the President ordered that we start thinking about what sort of encouragement we can give further in terms of welfare to our frontline workers. And I can confirm to you that these are ongoing discussions, And we will be announcing soon what we have agreed upon. And I can also confirm here that in addition to the government, there are also many people in the private sector who also want to do something. And this is also work in progress. So stay encouraged, stay safe, more than anything else, stay safe. As you are aware, in some of the countries that the disease has infected people, and I think in Spain, for example, it was about 10% of the infections were healthcare workers. Here, we do not want to hear of anything like that. We want to ensure that our health workers are the ones who are protecting us, not us treating them. I want to thank you very much. Thank you very much. Maybe you can take 2 questions. I think because of the rain.
Just 2 questions only. Yes, Raimba?
From maybe to Dr. Amoth, last time you did say that the month of April will be a month of reckoning for Kenya. Maybe with only 10 days left for this month of April, you do still hold that indeed in the next few days we do have to brace for hard moments as a nation?
Thank you, Kaemba. That was for Amoth, not mine. Yes?
Yes. The last one.
The question that I have is with regards to the sample size that you have tested in the last 24 hours and cumulatively, as well as what is the plan going forward for those patients that are being released? What, in the case of a reinfection, what is the plan?
I'm going to let Dr. Amoth respond to the technical issues, but let me just talk about the numbers we have tested so far in the country. Yesterday, we tested fewer than the previous day because of a shortage. There is a global shortage of one of the items that we are using, and we are hoping that we can get it between today and tomorrow. Essentially, it is, what do you call the nose of what? Whatever, that one. The one that's sticking in your nose. And this is the one that we are asking our people here, that this is not something we should be buying from China, really. Some sharp business person should be making these things, and we have got a big market. But so we have in total in the country 13,872 samples have been tested so far. Dr. Amoth?
Thank you, Waziri. I think we have had various modeling plans. The first one, of course, is the one we talked of, April being our time of reckoning. But if you look at the samples that we have tested, because of the global supply challenges in regard to testing kits and the commodities used for sampling, we have not hit the number that we had anticipated going forward in terms of the numbers we were expecting to have tested by then. So we'll still stand by that. And we hope that going forward, as we'll be able to test more figures, we can reflect back and see if those figures match what we had postulated earlier. But now that I have the floor, I would also want to take this opportunity to inform you that we have been in discussion with the manufacturing industry. Today we had a meeting with Bedi Investments from Nakuru in terms of local manufacture of PPEs, personal protective equipment. And yesterday we had a meeting with Shona EPZ from Athi River. And we want to confirm to you that these two industries met the threshold for manufacture of PPEs, and that their PPEs have been assessed by KEBS, and the top leadership of the ministry, especially the users, the doctors, the nurses, the laboratory people. And we are confident that we are going to deploy these PPEs for not only for Kenya, but for the entire region going forward. Despite this challenge, I think this has been a very big opportunity for us Kenyans as great innovators, so that going forward, we should be the leading country in terms of local manufacture of PPEs. And we are also in discussion with the Ministry of Industry to start local manufacturing of small consumables like what Waziri was talking about, the nasopharyngeal and oropharyngeal swabs for local use and even for export. Thank you.
So where the we do the beds? Yeah. Rockefeller?
Yeah.
My friend.
Don't mind. Please.
Oh, okay, you invite him.
Yes, let me invite him. Thank you, Waziri. Ladies and gentlemen, the first thing I would like to say is that I would want a moth to be wrong. Models are made so that you're wrong. They are not made so that you achieve them. Models are made so that government plans and you get them wrong. If they get them right, then there's no need of modeling, because then it means you didn't plan. So we hope a moth is wrong, but we hope he is right to allow us to plan. That's really important to understand. So don't look for the numbers, look for the action. The next thing I would like to say is that in this line of defense, in this battle, we have two lines of defense. One is individual, you and I. So please let us obey what the experts and the government are telling us, so that we can apply that first line of defense. The second line of defense is our health workers, our doctors, our nurses, our clinic officers, our lab experts, our community health workers engaging communities out there. And these need to be supported and need to be protected. And this is what Waziri has spent time talking about today. So I would really like to thank Rockefeller Foundation, because when the call came from KNH and the ministry saying we need to protect and support our health workers by putting up a center that is for them in case you have any incidences, Rockefeller came forward, and we really wish to thank you. They have donated about 100 beds, which are going to be put into these centers. They have donated preventive equipment that are going to be used, ventilators and monitors for standby. We honestly hope they are not used at all, but it's always good to plan and have them on standby. So what I would like to do is ask the Rockefeller MD, Mr. William Masiko, to make a few remarks. Thank you, Waziri. Thank you.
Thank you very much, Dr. Githinji Gitahi, Waziri, and the rest of the senior management team from the Ministry of Health. First of all, mine is just to thank you very much for your precise leadership, transparency in this fight. When I came to see you nearly just over 2 weeks ago, Waziri, you told me that you do not want words, you want action. And I'm very glad that in just under 2 weeks, we have been able to come and support you in your strategic fight against this enemy that nobody could have foreseen coming. Thank you very much for giving us this opportunity to serve you. Frontline healthcare workers are sacrificing so much, and as you said, in many countries, they are even giving the ultimate sacrifice by giving up their lives. We do not want to see that here, and we are very, very, very happy to support this. And as you said, we hatutachoka. We will stand by you. We are here. We are in the beginning of this fight. Nobody knows where it is going, but we will be there throughout. Thank you very much for this opportunity.
Thank you very much, William. And so that you can see me, I'll remove this and then I'll put it back as well. And this is how you hold it, not on the mask itself. I would now like to ask the health workers themselves to come and make some remarks, because they are the people in the front line. So it's always good to hear from them. So I'd like to ask the chair of the Nursing Association to come and make a 1-minute remark.
Thank you, Honorable Waziri. On behalf of the nurses and other healthcare professionals, I just wish to extend our gratitude to our partners, Rockefeller and AMREF, for this generous help that they have extended to us. And as you've said, we don't wish to get there, but we must be ready in case we reach there. And I also want to urge that the package, the welfare package that was announced by the head of state, His Excellency the President, Uhuru Kenyatta, be unpackaged, and we hope that it will be commensurate to the sacrifice that health workers are giving at this critical time. Asante sana.
Thank you very much. Yeah, you can clap. I would also like now to invite the chair of the clinical officers to also make a remark, and then I'll ask the president of Kenya Medical Association to follow, who is here with me. So clinical officers, yes.
My name is Manasseh Bocha. the Chief Clinical Officer in the ministry. Waziri, we want to thank you very much for your initiative to have this facility to take care of frontline health workers. As you know, clinical officers have been first affected with this COVID-19 disease. And the question they've been asking is, if we are isolated, are we going to pay for ourselves? But now with this answer, we want to thank you very much. Thank you so much.
The President of KMA, Jack Kitulu.
Good afternoon, everyone. I really want to take this opportunity really to applaud each and every healthcare worker, not just the doctors, the nurses, the clinical officers, the lab technologists, radiologists, every one of us. Thank you for standing out there and being on the front line of this battle. This is a different battle where it's the healthcare workers who are at the front. I want to thank the government too for the effort it's making in ensuring that these healthcare workers are protected and that they have adequate PPE. They need to be safe so that they can work and make sure that they keep the population safe. Of course, in the line of duty, remember these healthcare workers are just like you and me. I am one, but all of you out there, everyone has a fear about this COVID-19. So let's not imagine that the healthcare workers do not have a fear as well. And they are working under a lot of pressure. So as the Kenya Medical Association, in association with the psychiatrists, the clinical psychologists, we've set up weekly debriefing sessions to ensure that they also have psychological support. Further to that, we are also making sure then that the healthcare workers are trained. We are using innovative methods, ICT, to ensure that they also know how to protect themselves. In the line of duty, some people will get affected and will be exposed and may turn positive. And indeed, we are very delighted today that this building here that has been launched for making sure that there is an isolation and treatment center available to healthcare workers is something the healthcare workers of this nation will be proud of. Thank you very much, Rockefeller Foundation. Thank you very much, AMREF. Thank you very much, Ministry of Health, for taking care of the healthcare workers. Would also like to urge the healthcare workers, knowing that even as we get exposed, that we need to take this opportunity to ensure that we come in for testing, that we get tested, and that if we are tested and have been exposed, that we do follow quarantine rules. They apply to us as well, and this is for the benefit of our loved ones, our families, and for the benefit of the patients. All of this is to ensure that we are all looked after in a humane manner. So I will just conclude, Bwana Waziri. For us as in the medical profession, we do have a physician's pledge. And in that pledge, this is what we say at part of it. As a member of the medical profession, we solemnly pledge to dedicate our lives to the service of humanity. The health and well-being of our patients will be our first consideration. We'll respect the autonomy and dignity of our patients and will maintain the utmost respect for human life. So stay at home, keep safe, keep social distance, wash your hands, and ensure that when you stay that way, you also keep us as the health workers safe so that we can serve the community better. Thank you.
Thank you. Thank you very, very much. And I would now like to invite Kefa to speak on behalf of the public health professionals, because they are also in the front line in this response. Kefa, please.
Thank you very much. I think what we want to say is that we are very happy with the moves of repackaging and support to the health workers wherever they are. Our call to all public health specialists, public health officers, and public health specialists fraternity is that this is our opportunity to give our best. And indeed, the call for this moment is the highest basic observation of what requires to be done. And I think I want to call our colleagues, wherever they are, to give their best on behalf of Kenyans. This is the only time that we can give our best. Thank you so much.
Thank you very much. And finally, the chair of Kenyatta National Hospital Board, so that he can then receive the equipment. Engineer.
Very good much. Waziri and
all the health professionals here present today. Allow me, Waziri, to start by thanking you most sincerely from the bottom of my heart for the dedication, commitment, and selflessness that you have shown in the fight against this disease. People can be given jobs, but many times people do not lend their hearts to those jobs. And most of us, Waziri, believe truly that you've lent your heart to the fight of this disease, and through your leadership, Kenya will be much the better in confronting and defeating the disease. Ladies and gentlemen, we are here today to hand over the Isolation and Treatment Center for our frontline warriors in the fight against COVID-19, the healthcare workers. We must all appreciate that above everything else, healthcare workers are also human beings like you and me. They have anxiety, they have fears, they have families. They don't just need this kind of support, but they also need psychosocial support, and that falls upon you and me to do it. And therefore, in that regard, I thank most sincerely AMREF Foundation and the Rockefeller Foundation on behalf of the Board of Management of Kenyatta National Hospital for this timely event, this timely donation that's going to go a long way in making sure that we at all times communicate to our healthcare workers that we do care about them, we do care about their commitment as the frontline fighters on this disease. Of course, it is our hope, like Waziri said, that we don't admit a single one of them into this facility, and that's really our prayer. And I think from where we stand, Waziri, we have a lot to learn from. The mistakes that other countries have made, we don't want to repeat those mistakes. But most importantly, to AMREF and the Rockefeller Foundation, what you've done today goes to show what we need to do as the global community in order to be able to confront and defeat this disease, which is international collaboration. This disease does not know about social status. This disease does not know about who your father or your mother is. This disease does not know where you were born. This disease does not know how much money you have in the bank. As a matter of fact, some people, I'm told, when I was just being told yesterday, some of the most worried people today are those who have big bank accounts in other countries which they cannot access right now because of this disease. So really, this is what we need to do. As I conclude, Waziri, there's been this misinformation as Kenyatta National Hospital that now we are not doing anything else other than dealing with COVID-19. Nothing could be further from the truth. As Kenyatta, and on behalf, and because we are the leading healthcare provider in this country, we are the apex institution in healthcare provision, I want to assure you that we are all still attending to all other clinical conditions. Of course, this is a priority, it's a global priority. It is a priority for the nation, but let no one tell you that if you come here with any other clinical conditions, we'll be turned away. We are here to receive you, and we'll be doing our best. And I want to thank our frontline staff, especially those at Kenyatta National Hospital. They have gone beyond the call of duty just to make sure that we are all assured and we are all kept healthy. And wherever you are, whether in the media or wherever you are, wherever else in this country, please, we owe it to make sure that we give them psychosocial support, any kind of support, encouragement, so that they know the whole country is behind them. I thank you very much. May God bless you. May God bless our great country.
Well put, Chairman. Thank you.
Very nice words.
Yes. So we now hand over the badge to the Ministry of Health and the chair of the Kenyatta National Hospital and the health workers.
This is KTN News. World governments, including the Kenya government, in a bid to protect their people, have taken up the fight against the global pandemic that is COVID-19. And we, the Standard Group family, you included, are a part of this fight. The good fight.
Oh, okay. No, but you're getting the noodles.
Yes.
That's social distancing, please.
Yes.
Social distancing.
Good.
Thank you, I'm ready. Thank you, fellow foundation. Please come again. Yes. So we don't have to use this.
Yes. These are just a sample. There are many others.
Thank you, Waziri. Thank you so much.
Okay, and thank you, brothers and sisters.
Thank you. And don't look for the numbers. Look for the numbers, not to count. Yeah? You don't receive in this thing.
Thank you. Thank you so much. Thank you.
All right. Okay.
Yeah. No, in fact, we